So we'll give it just another minute and then we'll begin. All right, let's go ahead and get started. Welcome, everyone. I'm Michelle Bradley. I'm the Director of Consulting Services here at OhioNet. And today I'm going to go over the results of our statewide PERMAH workplace survey. And I'm going to provide you with an overview of the report, as well as some additional insights into what the data is telling us about the state of well-being of library workers in Ohio. And because we're recording, I am going to go ahead and turn my video off so you can just see the slides. Just a moment. All right, so I know this is the first time you may have used this survey tool, and you're possibly new to the PERMAH framework. And of course, an evidence-based method is important to all of us. So before we go through the results, I just want to give you a little information about the survey, which is drawn from Professor Martin Seligman's Wellbeing framework. He's at the University of Pennsylvania, and his framework points to 6 factors of feeling good and functioning effectively. And they are positive emotions, engagement, relationships, meaning, accomplishment, and health. And this PERMAH survey framework has been used by over 400 organizations spanning 145 countries. So for us, this survey was open to anyone who worked in an Ohio library over a period of time from September 27 to November 3rd. So keep in mind that this is an opportunity for us to look at just that moment in time, like a snapshot. So I'm going to walk you through the report, and I'll give you some additional insights. And then at the end, there will be time for questions. So I'm going to flip over to the report right now. So hopefully everyone can see on the screen our report. And as I said earlier, this is really a snapshot of the moment in time when Ohio library workers took the survey. So I'm going to use a snapshot lens to really look at the report around 4 key themes. First, we'll look at sample insights about the demographics who took the survey. And then we'll look at numbers insights, what the numbers in the data shows us about the state of well-being, workplace outcomes, and well-being amplifiers for Ohio library workers. Then we'll look at activation insights. So those PERMAH factors at the me, we, and us levels, and well-being nutrients, and then personalization insights. So let's take a look at the sample insights first, which are the demographic data. So I'm just going to scroll, don't want to make anybody dizzy, over to our demographics. So the demographic data, 355 people took the survey. So we felt that was a strong response in the universe of the number of library workers there are in Ohio. It is a small sample size, so we'll keep that in mind. Of those who took it, we can see 309 were women, 33 were men, 7 non-binary, and 6 preferred not to answer. And if we look at the age groups, we have over 100 in the 45 to 54 years age group, bracketed by around 80 in both the 35 to 44 and the 55 to 64 age groups. And then there were 57 in the 25 to 34 years age group, and then a small number over 65, and an even smaller number in the 18 to 24 age group. Under employment status, most of the respondents were full-time, and 140 identified as leaders in their organization, and 198 identified as team members in their organization. And if we look over to ethnicity, the respondents were primarily white, Caucasian, 315 out of the 355, followed by just 12 Black, African American, 9 multiracial, 4 Hispanic, 2 Asian, 1 Indigenous, and 11 others, or did not answer. So as we look through the results, just keep in mind the representation of the demographics. We also added a demographic question of what type of library do you work in? So it's not in the report, but I'll switch to the slide really quickly so you can see that. Whoops, back a second. So you can see of the respondents here, 68% worked in a public library, 18% in an academic library, 6% K-12, 6% special, 2% other. So I'll switch back to the report. And so those are our demographics. And before we dig into the rest of the report and our scores, let's take a look at what the scores and the numbers mean. That's on page 4 here. So when we start looking at the report, we'll have scores. And so anything that we have a score of 76 or higher, that's considered exceptionally healthy. However, it's not necessarily that we're trying to go for hundreds all across the board, because it's healthy for people's levels of well-being to ebb and flow. So if we saw like hundreds all across all the factors and we repeated this survey, it might actually suggest that people don't feel comfortable being honest talking about their well-being. So if we see scores of 70 to 75, that's a healthy average. Many people consistently score in that range. Scores of 60 to 69 are lower than ideal and may require attention, action, and assistance if sustained over time. And if we see scores of 59 or below, that's generally an indicator that people's well-being is struggling, and that this is an area that requires attention, action, and assistance. So let's go ahead and move to the results on page 6. And we'll start with the state of well-being. So this is a reflection of a single question that was answered at the end of the survey. Asked to take everything into account over the last 2 weeks, respondents chose which of these states best describes the way they've been feeling. And our results are on the left with the color, and on the right is scores from the general population or global norms that have been gathered from people just from across all kinds of industries who completed the PERMAH survey. So those general population scores are derived from approximately 50,000 responses from 2018 to 2022. So you can consider them as a general average score. And throughout the report, we can look at the results of our survey against those of the general population. And then the results show a level of thriving from high to low and a level of struggle from high to low. So just a little bit about what we mean by thriving and struggle. Levels of thriving help to assess people's ability to feel good and function effectively as they navigate life. The higher people's levels of thriving, generally, the better their levels of well-being. And people's levels of struggle help us to assess what's happening around them that may impact their well-being and how they're navigating those challenges. So according to the Wellbeing Lab, generally, even if people's levels of struggle are quite high, provided they also have high levels of thriving, they're statistically just as likely to be engaged and satisfied in life and perform just as well as someone who's high in thriving but lower in struggle. So if you look at our results, you'll see the 4 quadrants. And if we start by looking at the higher thriving folks, 12.4% said they're consistently thriving. And you can see that's higher than the general population. And we had 34.1% who said they were living well despite struggles. And that's lower than the general population. And that's an important group because people who fall in that quadrant are the ones who exhibit resiliency. So the ability to bounce back and thrive, even though there are struggles. And resiliency is an important quality. And these are people in our libraries that we want to learn from. How are they managing to thrive, even though they're having struggles? What are they doing? What supports are they getting that might help others navigate struggles? Now we can take a look at the lower thriving folks. So we had 34.6% report not feeling bad, just getting by. And this was slightly less than the general population. And people in this quadrant are generally identifying that there's no reason they couldn't be thriving other than maybe lacking knowledge, tools, and support to do so. Or they are really struggling, but they don't feel comfortable admitting this even to themselves. So ideally, the idea is that we'd like to move this 34.6% who are in the not feeling bad, just getting by sector up into living well despite struggle, or even sometimes consistently thriving, and doing that by providing tools and resources. And we really don't want any in that quadrant to slip into really struggling. And then in that last quadrant, we had 18.9% report really struggling. And this is higher than the general population. And the Wellbeing Lab generally finds 5 to 10% of people in any workplace are really struggling. And it would be unrealistic to expect that there would never be anybody in this group. But something to keep in mind is sometimes that state's temporary and caused by a family, a life, or a work event. And our well-being does ebb and flow, and struggles a normal part of life's up and downs. So it's okay to fall there occasionally. We just don't want people to consistently stay there. If this result was for our own organization, that we're working with, so say it was OhioNet, we would want to monitor that by periodically running the survey to see if it's a more permanent state. Also, we would just want to be mindful that introducing well-being programs for people who are really struggling can sometimes actually have a negative impact due to added pressure to be well. So what we really want to emphasize is that it's normal to struggle, and we really want to normalize that. So let's look at workplace outcomes right below that. This is an overall indicator of how people feel about their organization and the impact it's having on business outcomes. So it's just an easy way to check on how people feel about working in their organization or working in their library. And we can see that library workers scored within the exceptionally healthy range in engagement. And that's that first one. And looking at the data, people said that they felt strongly dedicated to their work and strongly committed to the organization. And this is higher than the general population scores. Performance was also in the exceptionally healthy range, with most people saying, I performed well in my workplace. And then we have satisfaction with a score of 67. And this is lower than the general population reports. And if you remember what our numbers mean, it's a lower than ideal score and may require attention, action, and assistance if sustained over time. The specific questions that related to this workplace outcome were an agreement with the statement, I was satisfied with my workplace, and I was satisfied with my job. So there was not high agreement with either of those statements. So just overall on the workplace outcomes, most people who took the survey are dedicated to their work. They feel they're performing well, but they aren't necessarily satisfied with their job or their workplace. And we may see some other results in this survey that could give us some information about that. So let's look at well-being amplifiers. This is, what are workers' levels of well-being ability, motivation, and psychological safety? And, what impact might this be having on their states of well-being? So the first one, well-being ability, that is someone's capacity, the knowledge, skills, and abilities to take care of their well-being. And we see a score of 61 here, which is lower than ideal and lower than the average population. According to the Wellbeing Lab, the good news is that research shows that the most reliable way to improve our abilities is to start with small well-being behaviors. And each person who took this survey did receive their own report with some small actions in it that they could take. The next one is well-being motivation, and that's someone's commitment to making well-being a priority. And here we have a score of 59, which is an indicator that library workers are struggling here. And this is a place that could use some attention, action, or assistance. And just for some insights here, some of the survey respondents wrote comments in our open field questions that related to this motivation, comments along the lines of that in their library, they're so understaffed and overworked that they're unable to make well-being a priority. The last well-being amplifier is psychological safety, and that's also in a less than healthy range. And the survey data indicates that many people did not feel that their team was a safe place to bring up problems and be honest about mistakes, and that they did not feel safe in the workplace doing so. And thriving in the face of struggle not only requires skills and ongoing commitment, but also the support of others. And psychological safety exists when we have safe spaces to talk about how we're trying to care for our well-being, what's working, where we're struggling, and what we're learning, without the fear of being judged. So it would seem that libraries need to focus on creating places where we feel okay talking about struggles. And additionally, we need to give people access to the knowledge, skills, time, and tools to take care of their well-being and their commitment to making it a priority. And as I said before, well-being ebbs and flows. So the idea here is not trying to see perfect scores, but to increase people's capabilities to care for their well-being at the individual, team, and organizational level. So I'm going to skip these two and come back to them and go ahead and look at activation insights on page 7. So this is the PERMAH factors I talked about at the me, we, and us levels. So again, these are the 6 factors of well-being that were identified by Dr. Seligman: positive emotions, engagement, relationships, meaning, accomplishment, and health. And we need to have some of all of these factors to feel good and function effectively. And it's natural for each factor to vary across time, situations we're experiencing, but feeling poorly in one area generally results in feeling poorly in others as well. So a goal in this section would be to consistently fall within a healthy to an exceptionally healthy range of 70 to 90. So let's just look at where the library workers who took the survey are getting their higher scores here first, and what we can learn from that. So let's look at meaning, where we see exceptionally healthy scores at the team and organizational level and a healthy score at the individual level. All of these scores being higher than the general population average and much higher at the organizational level. So meaning is about feeling connected to something larger than ourselves and feeling like the work that we do makes a positive impact. So these scores revealed that library workers feel strongly that both their teams and the organization did work that was valuable and worthwhile. So I was wondering why the individual level, while still healthy, was lower. And what I found was that most strongly felt
Step on the back. Okay, so we're taking this off.
Sorry, get muting back on there again. What I found was that most strongly felt that the work they did as individuals was valuable and worthwhile, and they were clear on why they did the work that they did. They scored both of those very highly. However, there was one more question related to meaning that pulled that score down, and it was the work I did felt so important, I found it hard to switch off. In fact, just looking at that particular question, it had a score of 55. Which means it's an area that many are struggling with. And it's something as a profession we need to pay attention to, because that can be a warning sign of burnout. So I'm sure that probably nobody here finds that terribly surprising. Another factor we see exceptionally healthy scores in is relationships, which is a really good thing because the research has shown relationships to be one of the most important elements in well-being. In fact, research shows relationships have a greater impact on life expectancy than cigarette smoking. So we see an exceptionally healthy score in relationships at the team level and a healthy score at the individual level. At the team level, people agreed that their team was encouraging and supportive of one another. So libraries should continue to nurture those team level relationships. At the individual level, respondents strongly agreed with the statement that I was encouraging and supportive of others, but they agreed less strongly that I received help and support when I needed it. And then we see at the organizational level a less than ideal score of 65. And the survey data shows us that this was in response to the statement, my workplace was encouraging and supportive of its employees. So relationships and meaning generally do lead the way for well-being in organizations, as you can see in the general population averages. So let's look at engagement next. That's about using our strengths to do the things we're good at and enjoy doing. And we have here an exceptionally healthy score at the team level and a healthy score at the organizational level and a lower than ideal score at the individual level. And when you compare those to the general population scores, they're higher at the team and organizational level, but lower than the general population average at the individual level. So the data shows that the library workers reported being deeply engaged and interested in their work, and they found both their team and their workplace to be interesting and engaging. But many said they felt worn out by work. They did not report feeling energized by work, and that's why we find that lower score in the individual level. So let's look at positive emotions. Positive emotions are feelings like joy, awe, and gratitude. And positive emotions are what fuel our resilience. And we can see an exceptionally healthy score at the team level. And when I looked at the survey results, the library workers really rated highly that they felt their teams were a positive group to work with. But when rating the workplace as a whole, they didn't agree as strongly that it was a positive place to work. So you see a slightly less than ideal score here, although not much different than the general population. However, we can see that positive emotions at the individual level receive the lowest score across all of the factors at the individual level of 57, which indicates that people are struggling and require attention, action, and assistance. And here, what contributed to that score was respondents reporting feeling anxious at work, not feeling calm, and not feeling excited at work. Of course, we know that could track with whatever different people were doing at the time they took the survey, or if it was a week, for a particularly annual dreaded task or something else going on in the workplace, and that will ebb and flow. And looking at accomplishment next. So that's about embracing a learning mindset and cultivating the grit we need to accomplish what's important to us. And the scores here are in the less than ideal range at the individual, team, and organizational level. So here are some insights into those scores. People were reporting that they, as individuals, set and achieved clear goals. They didn't feel as strongly about this at the team level, and even less so at the organizational level. At the individual level, they also reported that they are not regularly seeking feedback about their work. Many feel overwhelmed by tasks, and they reported agreeing they were judgmental and critical. And I'm very sorry. I'm working from home and UPS has arrived, and I was expecting a document that I have to sign for. So my well-being would greatly appreciate it if everyone would have patience while I mute my mic. Thank you very much. And my dogs have stopped barking, so we can carry on. So I was just moving, going back a minute back to accomplishment. Just kind of summarizing that again. I talked about at the individual level, They also reported that they're not regularly seeking feedback about their work, and many people felt overwhelmed by the tasks they have to do. And they reported very strongly agreeing that they were judgmental and critical of themselves. So now I'll move on to health. So health is about eating well, sleeping well, and moving. And here, our library workers who took this survey are really struggling. So according to these scores, and really more so than the general population, what they reported here was that many of them are not feeling strong and healthy, at least during the time the survey was conducted. Most don't see their team as helping them to feel physically healthy, and many also don't see the organization as making efforts to support their physical health. So I'm going to scroll down on this same page to workplace well-being nutrients. So these are environments that enable people to fulfill their basic psychological needs, and they can undermine or amplify people's well-being. Studies have shown that environments which make it easier to thrive consistently provide them with each of these nutrients. And again, the scores of 70 to 75 are healthy results for these nutrients. And doing poorly in one of these areas can have a ripple effect across the workplace's levels of well-being. So if we look across at these nutrients, we see a healthy score in diversity and inclusion. Again, keep in mind the demographics of who took the survey. When I look into the data, although the majority of respondents strongly agreed to the statement, I work in a team where diverse ideas, experiences, and people are valued. When I look at the scores, there were about 14 respondents who gave that a 0 or a 1, meaning they strongly disagree. And there were also some that reported, I felt discriminated against in my workplace. And so in the universe of how many people responded, it still scored high. However, in the data, there were people that disagreed with the statements. There were also scores in belonging, competence, and autonomy. They were all in the healthy range and higher than the general population. So in general, library workers taking this survey are reporting they work in an environment that fulfills their basic psychological needs, except for the areas of resources and physical safety, where the scores were less than ideal and quite below the population average. The resources question related to my workplace demanded too much from me, and I had all the resources I needed to successfully do my work. And for safety, the responses were that many did not feel that their workplace was highly committed to health and safety. So those are the workplace well-being nutrients. And again, I'm going to skip past the well-being barriers for just now and go down to personalization insights. So these are those PERMAH well-being factors by the state of well-being. Whether they were really struggling, living well despite struggle, not feeling bad, just getting by, or the consistently thriving people. So how did people in each of those quadrants score on the PERMAH factors? So caring for our well-being is not a one-size-fits-all solution. For example, people who are consistently thriving tend to be differentiated by their higher levels of positive emotion and health than others. And you can see that here in our scores as well. In fact, the only sector that scored in a healthy range on health were the consistently thriving folks. While people who are living well despite struggles tend to draw heavily on their relationships and sense of meaning in their lives, which is also represented in these results. And keeping in mind that that's considered the most resilient group, we might want to have conversations to find out what we can learn from them in this area that might help those people that are not feeling bad, just getting by. What are the things they're doing that others can replicate? So we want to understand how to help that group that's not feeling bad, just getting by, move up on the continuum. And then remember that 18.9% were really struggling when they took the survey, and it's positive emotions and their health scores that are very low. And the research shows that we know that experiencing a health issue can really affect all the rest of the factors. So again, we want to continue focusing on normalizing struggle and talking about it without repercussions. And right underneath that, that's those well-being nutrients again, also by the state of well-being. What's interesting here is that in all but the consistently thriving group, resources were the lowest scored nutrient. And as you recall, I mentioned in the survey data, people said, my workplace demanded too much from me. This was also the subject that people addressed in the open field question when we just simply ask, is there anything else you want us to know? There were several responses relating to not having enough staffing resources to meet the demands of the workplace. And then in this sector too, if we want to learn from the living well despite struggle folks and take some actions to try to move those not feeling bad, just getting by folks up in thriving levels, we might want to look at belonging, as that's the area they scored higher in. So we might want to find out, what are they doing to connect deeply with others? So I want to go back to the well-being struggles on page 6. So we asked on the survey, these were single item, multiple choice questions, what their biggest well-being struggle was. And the list that they could select from was my physical health, my mental health, dealing with people, managing money, navigating changes, caring for others, and then just other. And you can see the respondents in our survey said their number one well-being struggle was their own mental health, the second, dealing with people, and the third, their physical health. Very, very similar to what the general population has reported as their well-being struggles. And then we asked, what would your top 3 most valued forms of well-being support be? So this is what they're telling us would be beneficial to them. And this was also from a list of multiple choice. So number 1 was having good health benefits. Number 2 was being provided with well-being and or resilience training. And the third was wellness classes. And then we'll go back to looking at well-being barriers on page 7. So we asked, what are your top 3 well-being barriers? And the responses here were not enough time, which tracks with all the other answers we've seen in some of these areas, too much mental energy required, and not sure how to start. So again, we know that from the research from the Wellbeing Lab that they found that when it comes to our well-being, tiny is mighty, and those individual personal well-being plans that each person who took the survey received, they're packed with tiny well-being activities that don't cost anything for people to experiment with. And again, since most of the lower scores were at the individual level, we do want to encourage people to make the plan a priority and hope that they and their workplaces can create the space and the time for them to do so. To the right was the question, top 3 people I asked for help when struggling. So you can see here, people said, number 1, they talked to friends or family. Second, someone in my team. And the third was, I would never tell anyone I was struggling. So on that last one, keep that and take that in consideration when looking at the levels of thriving. There may be many more respondents who are really struggling than they indicated if they would never tell anyone they were struggling. And people who don't feel safe to ask for help when they're struggling with their well-being at work, or who first turn to someone outside of work, are statistically more likely to report lower levels of well-being ability, motivation, and psychological safety. Who people are turning to for help is a good gauge on how safe they feel to talk about their well-being struggles in the workplace. So that is the overview of the report. And just a little in summary, when this survey was done, right? At that point in time, there were 12.4% consistently thriving, 34.1% living well despite struggles, 34.6% not feeling bad, just getting by, and 18.9% were really struggling. And in general, library workers who responded to the survey are very dedicated to their work, committed to their organizations, but not necessarily satisfied with their job or their workplace. And additionally, when it comes to people more actively and mindfully caring for their well-being, it's important to look at their levels of well-being ability, motivation, and psychological safety. And of course, the survey indicated that all of those amplifiers are at a less than ideal level. So we may want to delve more into finding out how we can create psychological safety in our libraries so workers feel comfortable talking about their well-being and their struggles. And the PERMAH well-being factors, meaning is really fueling people, and library workers are exceptionally devoted to the work they do, but we need to be cautious about burnout and compassion fatigue, as many are reporting not being able to turn work off, feeling overwhelmed by tasks. We see healthy levels of relationships at individual and team levels. However, organizationally, libraries could improve on ways of being encouraging and supportive of their employees. We see healthy levels of engagement at the team and organizational level, but at the individual level, we need to find ways where they can be deeply engaged and interested in their work, but in a way that doesn't deplete their energy and lead them to feeling worn out. We see that teams are seen as positive groups to work with, but workers themselves are feeling anxious. The accomplishment score indicates that libraries could do a better job of setting and communicating clear goals and providing regular feedback to staff. And also that as a profession, library workers appear to be pretty judgmental and critical of themselves. Overall, the library workers who took the survey at this point in time are really struggling to feel healthy and strong and don't feel their teams or their organizations make this a priority. So again, I'm just going to slide up to my slides here. Our goal is not just to increase scores, but to provide everyone with resources to help navigate highs and lows in the workplace, and to move more people into the thriving despite struggles category. So what comes next? Well, at OhioNet, we did our own workplace survey just for those of us who work there. And based on our results, we held staff conversations and ultimately created a workplace well-being plan. And we plan on taking the survey ourselves again after a period of 6 months to see if we're making any changes, if things are more permanent states. Obviously, we can't use this statewide data or this survey to make changes at your actual libraries, but we can use it and you can use it to promote awareness of well-being in the workplace, to advocate for libraries to make well-being a priority, to facilitate safe conversations about well-being, and to create tools and trainings for libraries. What we are going to be doing over the next several weeks is to have some virtual group conversations about our scores and what we found out in each of these elements, to glean more insight into the responses and to generate ideas for helping libraries and library workers in each of those elements. So we'll introduce some small interventions that libraries can consider for each well-being element, but we also want to learn from each other. So we want to learn what's working well at some libraries that others could replicate. So all of these sessions will be on Fridays from 11 a.m. to 12:30 p.m. And you can register for them on our website under the training tab. They are labeled as Library Workers Wellbeing Exploration Sessions. And registration is free. Sign up for all, sign up for one, whatever works for you. We also want to remind you again that you each received an individual report, and we encourage you to make time to try some small steps to help you feel good and function effectively as you navigate your normal highs and lows of work life. And as you take actions along the way, there's a part in your report as well as your individual report to stop and think about, what's working well for you, where are you continuing to struggle, and what are you learning about caring for your well-being. And we want to say to remember that today's data is just a starting point, and know that well-being doesn't equal being struggle-free. There's lots of simple things that individuals, teams, and the organization can do to care for well-being. And if there's anything that you want more information on, please feel free to reach out. I will stop sharing the screen in a moment and turn the camera back on if anybody would like to ask questions at this time. Or again, you can email me at michelleb@ohionet.org on the bottom of the slide there. We want to thank you for taking this first step to really measure and address well-being in our libraries in Ohio. And you've already made a positive difference just by doing this. And we'll continue to share what we learn with you. We'll hopefully develop some tools and trainings you can use. Additionally, if you're interested in administering the PERMAH workplace survey in your own workplace, you can also reach out to me at my email address, and I can give you more information on that. So I am going to stop sharing and turn my camera back on. And feel free, I'll open the chat box as well. If you have any questions in the chat, or you can just unmute yourself and talk. So. We are also, the report is available on our website. If you want to print it out, delve into it further, think about what we talked about today. We also, as you know, recorded this session. So feel free to share it with others or watch it again as you look through the report to see if there's any data that you can use. I will also mention, I have been certified by the Wellbeing Lab to analyze and debrief and administer this survey. This is also a course. If anyone's interested in really delving into this in your own workplace and you want someone in your workplace to be certified to administer and debrief the surveys, reach out to us for that too. We can connect you with the Wellbeing Lab so you can get that training. Thanks everyone for coming.